Good evening. Hello, I'm Dr. Garry Cussell from the Specialist Clinics of Australia, and I'm here tonight to talk to you about and give an information session about laser treatments in 4 common gynecological concerns or problems. They're common concerns for which there's usually no easy other alternative treatments. The 4 treatments that the laser is commonly used for are things that happen frequently after childbirth, particularly after several vaginal deliveries and also after menopause. The symptoms are those of stress incontinence, which is bladder leakage, something that occurs frequently with any form of sudden strain or stress, such as coughing or sneezing or even laughing, and certainly more vigorous exercise. The second thing the laser treatment is very good at treating is general laxity and looseness after vaginal birth and reduced sensitivity. So the vaginal laser is able to tighten and strengthen the vaginal wall, improving that. The third thing it helps is with small degrees of anterior wall or lower vaginal wall bladder and bladder wall prolapse, which presents in a feeling of heaviness or fullness down in the vulva when the tissues aren't held up as well. And the fourth treatment is to try and improve lubrication and mucus and rebuild the vaginal wall after menopause due to lack of estrogen. So I'm going to discuss these 4 indications, which are fairly common, talk about the alternatives, and talk about how this treatment can help. Now, one would think that any type of laser inside the vaginal tissue would be invasive and painful, but in fact it's the opposite. It's a very simple, non-invasive, non-painful procedure. Usually there's no downtime or recovery period, and quite surprisingly this treatment really does work. We've been doing it in our clinics now for close to 4 years. We've done quite a few hundred treatments with many different people, and for early to moderate stress incontinence, for vaginal laxity, for early minor vaginal wall and bladder wall prolapse, and for postmenopausal dryness, we're getting excellent results within the first 3 or 4 months of treatment. The laser is a very simple laser, and just to demystify it, I want to tell you how it works so that we take the scare factor out of it. When we look at a diagram of what diagrammatically the vaginal tissue and the bladder and the uterus and the bowel behind it looks like, and what the laser looks like when it's actually inside the vaginal tract, the laser tube or probe is in fact smaller than a normal vaginal speculum that we use for pap smears and vaginal examinations. So the probe itself that goes in is not uncomfortable. The laser beam goes through the middle of the probe, and it's reflected either upwards towards the bladder wall above the vagina or circumferentially around the vaginal canal. And what it does is it delivers a regulated and controlled heat. It's not a burning laser that causes any burns or serious side effects potentially to the internal tissue. It's gently heating the tissue, and the heat does 2 things. It contracts and tightens the tissue that's there, and then slowly it builds more tissue. So for all of these 4 indications, what we're trying to do is tighten, strengthen, firm, and rebuild the tissue that's been stretched or damaged or loosened through vaginal delivery, through general aging concerns, or through lack of estrogen for a number of different reasons. And I'll go through the various causes of that as well. So that's the treatment. It's pretty simple. Once we do a consultation and explain it in detail personally, take a detailed history of your gynecological health and your general health, and we deem it may be suitable for you. We discuss the pros and cons, and if you want to go ahead with the treatment itself takes about half an hour. There's no downtime afterwards. You can resume normal activities socially or go back to work, and there should be no discomfort after in most cases. There are exceptions, and I'll discuss that. And I'm here to answer a lot of questions. So if any of you want to post online questions, please feel free to do it now, and I'll endeavour to answer as many of those questions as I can in the limited time now, and any questions that are posted after the talk or in future, we'll keep an eye on the website and attempt and endeavour to answer any personal questions, whether you want us to answer it in the online forum or whether you'd rather have a private email. I'm happy to do that. And we offer a consultation, which is at a normal consultation Medicare rebatable fee. If you want to ring, I would suggest that you log on to our website that's listed on the site here. There's a lot more information about the treatment and the procedure, what it works for and how it works. And feel free, if you want to make an appointment, to come in for a consultation. Now, let me go into a little bit more detail about how this works and who it's likely to work for and who it doesn't work for, and why it is an alternative to some forms of surgery that are often suggested by people who don't know about these lasers, or before these lasers came about, how we treated, if possible, these conditions. So probably the commonest condition that's most appropriate for the Northern Beaches Mothers Group is you've all had children, presumably. A lot of you have had vaginal deliveries, often several, and stress incontinence is a very common symptom that happens, maybe not initially. Sometimes it does happen very soon after childbirth. Sometimes it only happens after subsequent vaginal deliveries. Sometimes it happens a few years later. And sometimes it's just something that happens throughout the later 30s and 40s, just through weakening of the tissue for other reasons. But essentially what causes stress incontinence is the lack of support of the bladder wall by the vagina. So as you can see from here in this diagrammatic version here, the vagina is just simply a tube. At the end of the vagina, we've got the cervix and the uterus coming up here. Above the top wall of the vagina, looking this way, you've got the bladder tissue, and below is the bowel. Now, in a strong, firm, tight vagina, the bladder wall and the top vaginal wall shares a common wall. They are separate, but they're conjoined. And if the vaginal wall is strong, it will hold up the bladder. When the vaginal wall is stretched and becomes looser, and particularly with a full bladder, with that pressure downwards, and certainly with usually it takes a reasonable cough, sometimes only a mild cough, sometimes even laughing, certainly with vigorous exercise such as star jumps or running, you will get often people get some bladder leakage. Usually women can feel it as a little bit of a leakage. It's usually only a few drops, if that, but you're aware of it. It's probably not enough in most people to soak a panty liner. Sometimes it is, sometimes it's more significant, sometimes it comes through to the clothing, but it's certainly a nuisance. And it's caused by that sudden strain causing the sphincters at the lower end to release a bit of urine. Often people can avoid that, for instance, with coughing and sneezing, by just tensing up and trying to hold their bladder a bit tighter, but often accidents happen when you're not expecting it. A lot of people have to modify their lifestyle, their activity. They stop playing tennis, they stop going to the gym. Their They know every toilet in the shopping centre, and they're forever watching their bladder to make sure it's empty so they don't have any accidents. Now, is there any other gynecological treatments in the past or present that can actually help that? Because it's a relatively minor symptom that doesn't cause flooding and doesn't really warrant major invasive surgery, most women don't do anything about it. They just learn to live with it, they modify their behaviour, and they just start wearing pads. But it can become more troublesome, and the point is that with these new lasers, which actually work, you don't have to put up with it. This treatment does help it. May not completely stop it in the first 3 treatments, but with maintenance treatments and ongoing treatments, it usually controls the symptoms back to the level where you're comfortable, or it may in fact keep you completely dry, which it does in a lot of people who have early and non-advanced stress incontinence. The surgical alternative for this is actually sewing mesh tissue between the vaginal wall and the bladder, attached to the side wall of the pelvis to actually physically hold the bladder up. It is fairly major invasive surgery, and it does have some complications. So a lot of people tend to shy away from that and just put up their symptoms. Now, how does the laser work? What does it actually do? What's the treatment involved? The recommended treatment in most clinics, and let me say that there's about 40 groups of medical doctors, gynecologists and cosmetic doctors who are used to laser medicine right around Australia who are doing these procedures regularly now, and they're getting a lot of repeat and referral business because of the fact that it is non-invasive and it's effective, and it's becoming more popular and more well known. It is a sensitive thing to talk about, so a lot of people aren't aware of it, so the general knowledge about these procedures is generally pretty poor. But these lasers are used now in virtually every country of the world. They were pioneered about 5 years ago in both Italy and Slovenia, and since then there's been a lot of new laser development, new applicators, so it has advanced and it will continue to advance. There's 3 types of heat treatments, and essentially they're all heat treatments that work, and there's very little difference between all of them. The pioneering lasers that were initially used were a CO2 laser or a carbon dioxide laser and an ND-YAG laser, and later the development was with a different form of heat using radio frequency energy to create the same effect and the same improvement. We've got all 3 of these devices in our clinics, and we've been using all 3, and we're conducting a long-term trial longitudinally over all our clients and patients who want to go ahead with it. And we're trying to see if there's a difference between any of these devices, the settings, the number of treatments, the frequency of treatments, the interval between treatments. And quite frankly, so far we can't find any difference. All 3 of the heat treatments work, whether it's CO2, erbium laser, or the radio frequency device. And you can find more information again on our website and generally on the internet. Now, how does it actually stop stress incontinence? So we do 3 treatments once a month, each treatment taking about half an hour. The laser probe goes into the vagina like so. We do treatments angling the heat and the light source up to the front wall of the vagina, and the second probe goes in and it treats circumferentially and heats the whole vaginal circumference. Now, heat causes 2 things to soft human tissue like this. It causes immediate contraction. So all our tissues are made of collagen, which is essentially protein. And when you heat protein, it's a scientific fact that it will always shrink and tighten. So the tightening phase of the improvement happens very quickly. The strengthening phase is again a very well-known scientific principle that a certain amount of heat to human tissue delivered at a certain depth will cause the release of a whole cascade of events that ends up in more collagen being produced. And you can research that if you want to. You look into collagen build-up, and heat causes heat shock proteins to be released. Heat shock proteins release growth factors, and the growth factors stimulate new tissue growth. And it takes about 4 to 5 to 6 months for new tissue to growth. So there is a bit of a delay in the strengthening phase. And for the 4 different indications that we use this laser for, there's different timings of when you can expect results. So I'm seeing there's a few questions being asked online, and I'll come to those in a minute. I don't think I've got a strict 15-minute timeline. I've just gone over that. So if you want to wait on, I'll try and answer those. And those that can't wait on, I'll answer them after I go off air. Now, the laser treatment for stress incontinence is the most common, the one we use probably most successfully. People who are just wetting a little bit and who will wet only with a relatively severe cough or sneeze or significant exercise, they will start to get some improvement even after the first treatment. We get you back for the second treatment a month later, the third treatment a month later. We bring you back for a consultation and follow-up check 3 months after, and again 3 months after. And we take a detailed history. We've developed an application where we fill in all of your symptoms and how severe they are and what the causes of it is. We ask the same questions each time. We see a gradual diminution and reduction in all of your symptoms. Most people with stress incontinence have improved very significantly by the 3rd month after the 3 laser treatments, and by 6 months after the 3 laser treatments, they generally are at the maximum improvement. If there's not enough improvement in more severe cases, we then go ahead and do a maintenance treatment. Now, with some of the conditions, the progress is a bit slower, but in stress incontinence, by the 3 months check, most people have had a very significant change. With more severe cases, there may be a maintenance required up to 3 times a year. Generally, we like to predict and get people to think about having 2 maintenance treatments a year, one every 6 months. If a female is young and only had a couple of deliveries and is not very loose and they get a good reduction in symptoms, well, we don't treat them until they start to get symptoms again, which may or may not happen. One of the questions that I was asked before coming online that I'll answer now is someone asked if I've had some pregnancies and I'm planning another one, should I think about leaving it until after the next pregnancy, or should I do a treatment for stress incontinence before? Well, the tissue's been stretched and is weaker and it's not supporting the bladder now, so you're better off to strengthen and tighten that tissue now, build up new tissue. It is renewing tissue. It will stop your symptoms so that during the pregnancy you're less likely to be inconvenienced by it. After the next pregnancy, if it is a vaginal delivery and you stretch further, like everyone will probably need maintenance along the way, you can then start the maintenance. So I think from a common sense point of view, it's better to do it before the pregnancy. Right, now that's I think as much as we can get through on stress incontinence today. General vaginal laxity is becoming more of a popular reason for doing it, and that's more for just affirming a tightening, which has an effect on sexual gratification, both for the male and female. But one of the things that happens, and very commonly associated with stress incontinence and vaginal delivery and stretching generally, and laxity generally, is lack of vaginal sensitivity. And that also tends to improve relatively quickly with the laser. And that's a very positive finding as well. The third indication is prolapse. Now there's different types of prolapse, and we've got to diagnose you carefully. We don't expect these lasers to have long-term effects on holding up a prolapse of the uterus and the cervix. That usually requires hysterectomy and pelvic surgery to hold it up. It's often called called an anterior vaginal repair, or a hysterectomy, a colposuspension. There's different types of procedures, and for that you obviously need to see a specialist gynecologist or a urogynecologist who can advise you on what's necessary. The majority of people who have stress incontinence, when you examine them, the front wall of the vagina, which is in common with the lower part of the bladder, comes out and protrudes a little bit, particularly when you strain down. Some people have it more significantly, and they can actually feel a bulging in the vulva, and sometimes they actually have to push it back. If it's a significant bulge and they have to push it back and it comes down voluntarily just through standing and exercise, the chances are the laser won't repair that. But if, as we find with most people examining them with minor stress incontinence, they've got a little bulge that only comes down with straining and goes back by itself, that can cause a heaviness or a discomfort in the vulva, but that does self-correct itself with the laser. So we're getting very good repair of that. Often ladies aren't actually aware of that when you ask them, but when they have the treatment and you get them back for after the second or third treatment or at the 3 months check, and you ask them again, do you think in hindsight you were aware of an uncomfortable, heavy bulging feeling? They say, well, in hindsight I probably was, because whatever I did feel seems to have gone. So generally, if you tighten tissue, it's going to lift and strengthen it. Right, now the fourth indication is more for the older mums in their late 40s or 50s or later, even in their 60s and 70s, who have got vaginal tissue atrophy, it's called, due to the mucous membranes of the vagina losing the positive effect that estrogen causes on the vaginal tissue. And usually within 2 or 3 years of going through the menopause and lack of estrogen, the mucous membrane reduces in size, shrivels up, isn't capable of producing as much mucus, and causes problems with having intercourse. Even lubricants often are not enough to make intercourse less uncomfortable. Often intercourse is very painful, a condition that you might have heard of called dyspareunia. The fix for that most people have used in the past is estrogen, but there's a lot of women who do not want to use estrogen because of the potential side effects or risks perceived with some of the problems with estrogen. And when people have been through the menopause and they've lost their hot flushes and they don't feel or they don't want to maintain hormone replacement therapy, unless they use estrogen pessaries or estrogen cream regularly inside the vaginal wall, that vaginal wall will shrink away in atrophy. Now, the problem with vaginal pessaries and cream is women get sick of using it all the time. You've really got to use it more than 2 or 3 nights a week to maintain a healthy vaginal wall. So compliance with topical applications is not very good. Now we have a lot of women in their early menopause, in their 40s, certainly in their 50s and 60s, who have this condition, which is very common, it's very natural, but once again, surprisingly, the laser can reverse that. It can actually rebuild the vaginal mucosa. There's a lot of other problems associated with this vulval atrophy or lack of estrogen stimulation for the vaginal mucosa. The vaginal mucosa is a little bit like the bowel mucosa. It has to be healthy, it has to have a balance or a symbiosis of all the vaginal flora, similar to the bowel flora. So it's the balance of the yeast, fungi, bacteria within the vaginal wall to remain it healthy. As you probably all know, if you take antibiotics and you kill the good bacteria, often you get thrush, which is an overgrowth of fungus. Women postmenopausally who can't or won't use estrogen are often prone to more infections, often urinary tract infections or vaginal infections, as well as this vaginal irritation, itch, or discomfort and pain. Now, rebuilding the vaginal mucosa obviously takes a longer time than it does just to strengthen and tighten tissue with the other three indications I mentioned earlier. Generally, you're waiting at least 6 months to try and get some relief, but it does rebuild the vaginal mucosa, and there have been quite a few studies done, generally in big teaching hospitals in major centres. I know in Italy there's been quite a few studies, and in South America, relatively small trials, but doing biopsies of vaginal tissue, and it shows that the vaginal tissue, which may have atrophied to be half its normal thickness, has regained its normal thickness within 6 months. So we've got physical proof that this actually works, but the practical proof is that the majority of people who have this vaginal dryness, their symptoms reverse gradually, especially by the 4th, 5th and 6th month. Now, these people, unless they start using estrogen, their tissue is going to start to become atrophic and deteriorate again several months after the treatment's finished. So postmenopausal maintenance is at least twice a year, and often 3 or even 4 times a year. The good thing about the laser is once the vaginal tissue is rebuilt, it tolerates that heat very well. There are minor treatments that shouldn't have any risks or side effects, and a lot of women do come in every 3 to 4 months for a maintenance treatment. When we start treating people who've lost a lot of vaginal thickness and moisture, we have to start very slowly, and we do much lighter treatments. There is a class of people, and I know I'm carrying on a little bit beyond your scope, but for instance, there's a lot of women who've had breast cancer. It's an estrogen-sensitive cancer. They're on estrogen suppressing medication, anti-estrogen drugs, and this dries up their vagina very quickly, and they really suffer a lot. And the laser is being used more and more for these people as well. Even the Chris O'Brien Cancer Centre at Prince Alfred has now got a laser and is doing trials on it for these type of women who've been through breast cancer. So that's basically the rundown on the 4 indications for the treatment. If you look on our website, you'll get a lot more information. And now I'm going to proceed to answer a few more questions. One of the questions was, what is the aftercare, and what do I do following the treatment? Well, in fact, there is no aftercare. We don't need to, and we don't suggest any creams or anything inside the vagina. The reason we're doing this treatment is to take away that need, and generally you don't need to put anything inside the vagina. There is some discharge often, especially with the younger people. They'll get a clear or sometimes a slightly yellowish mucus discharge. It's not copious, it's only a small amount, and we encourage ladies to use just a panty liner for the first 2 or 3 days in case that they get that discharge. With stronger treatments where we're trying to accelerate the result, and we use a hotter laser, surprisingly it doesn't hurt more, but you can get a little bit of spotting, but that's unusual. Sometimes you get a bit of pinkish discharge for a day or 2, but that settles. So we really don't say there's any aftercare. Obviously the tissue inside takes 2 or 3 days to recover, so we ask you to avoid intercourse for 2 or 3 days. Okay, now I've just about run out of time, I'm looking for another question that I can answer easily. One of the questions was, do I need to see a gynaecologist to have a proper diagnosis before I go to one of the clinics to have these treatments done? Because every laser importer of a laser, of a carbon dioxide or erbium laser nowadays, is developing vaginal probes for their lasers, because it's such an easy, simple treatment and it actually works and it's very successful. There are some pitfalls and traps, and unfortunately there are non-doctors who are actually doing the treatment. Our recommendation is always be safe and go to a doctor for proper advice and examination. At our clinic, we've got 4 gynecologists who perform this treatment and are doing it regularly, and we've got another 2 gynecologists who are joining us. But it's not an invasive treatment. We're not treating the cervix, we're not treating the uterus. The light or the heat is not projected up towards the cervix at all, so it can't have any effect on an abnormal pap smear. It can't have any prerequisite for having problems with the uterus. It has no relation, and it can't cause uterine cancer or cervical cancer. The heat of the laser is very regulated to a certain depth within the vaginal wall, so it doesn't radiate up above to the bladder, so it has no direct effect on the bladder, and it doesn't radiate below to the bowel, so it has no effect on the bowel. So it's a very safe laser, and obviously as part of the history that we take, we go through a full gynecological history, and if it is a non-gynecologist doctor who's consulting you and we're not 100% happy that there's any gynecological problem that may be of a concern, we'll get you to see our gynecologist before any treatment. But the treatment is all done by doctors and not nurses, and certainly not non-trained medical people. Okay, so I think that's answered all the questions. I've gone now over half an hour, so I'll log off now and I'll say good night, but you're welcome to keep posting questions as much as you like. You've got our web address on screen, and our email address is on that. You're welcome to direct private questions if you want to, and my team and myself will endeavour to answer those either tonight or tomorrow. And if you've got any personal questions, you're welcome to make an appointment for a consultation. Thank you very much. Good. Bye-bye.